One of the most difficult problems that we have in the clinical treatment of MS is the fact that there are 14 approved drugs for relapsing MS. And it would be nice if we could do comparative trials of drug, X to Y or Y to Z, but that realistically will never happen. What we can do to get at it, though, is that some of these drugs have been on the market for 3, 4, 5 years, and some as long as 14 years, as Rebif has. What we can do is we can look at real-world evidence. Let's look at 10,000 patients with MS, and let's find a group that were relatively well-matched at baseline, but were treated with therapy X or therapy Y, and see how well they did. And we have 3 posters at this meeting now that reflect that when you do these kinds of real-world evidence, that Rebif is similar in terms of comparative effectiveness to Tecfidera or even Aubagio, and at the same time is associated with less healthcare costs and less healthcare utilization, implying a better outcome. All of that work is extraordinarily important, but if we are to get at a modern understanding of how all of these 14 drugs would compare using these kinds of real-world evidence, virtual clinical trials, is, I think, a mode of data generation that you'll see a lot more of in the future. Doctors in clinics, really want to be able to say, is this drug better for my patient? And what does it mean to be better? Well, it's got to be more effective in treating the disease. It's got to be appropriately safe. It has to be tolerable. And frankly, it's got to be a drug that's easy enough for the doc to start and monitor and the patient to continue to take. And in the absence of any formal randomized clinical trials, head-to-head experiments, the only way we can get at that is well-designed, well-executed examination of what happens in the real world, where you have a wide variety of patients treated by different therapies, and then determine how they actually do in a comparative way going forward. And this is going to be the future of medicine. It's big data, and it's going to give us insights that randomized clinical trials could never have afforded. I think it's very true that physicians tend to use drugs that they're comfortable with, that they know what the efficacy is and they know the safety profile, and Rebif is a great example of that. Starting newer drugs, well, there's some physicians that are early adopters of new drugs and they like to try anything that was just approved, and there are other physicians who are a bit more conservative. I would welcome that patients consider the new medications and discuss them with the physician, and the physician should be prepared to intelligently discuss it at that time. At the same time, these newer drugs, we don't know what the long-term implications of them are. We're hopeful that they will be rather mild. But for the right patient with the right disease activity and the right profile, Rebif particularly is a very viable choice, and the drug continues to do very well for a lot of patients.